Good evening and welcome to the Pitt County Board of Health meeting. Appreciate everyone out there who's listening. Thanks to the board for being here tonight, and happy Valentine's Day. I hope you've had a good one so far. I appreciate everybody being here. I promise we'll keep the meeting brief in case you have other festivities to attend to this evening. Our first order of business is, after we've called the meeting in order, is public comments. Is there any public comments for the board to receive tonight? Hearing none, I will tell you that we received a communication discussing staffing issues with health department clinics, and in response, I've asked Dr. Silvernail to be prepared to provide the board a full report and deep dive on the clinics, how they're operated, how they're staffed, and the current situation. And we'll get that at our next meeting, if there's no objection from the board. And next would be to approve the minutes. So Lauren sent those out ahead of time, and I trust everyone's had a chance to review them. Any questions or corrections to the minutes? If not, a motion would be in order to approve the minutes.
So moved.
Any discussion? Without objection, we'll let the minutes stand approved. Next, Marcia Hall, fiscal report. Good evening, Marcia. Happy Valentine's Day.
Hey, thank you. I hope everybody's doing well. We are talking about the end of January, which is period 7. We did not have, so basically January we had 2 holidays, which I think resulted in some of our low pro rata versus actual, but no budget amendments, and we had some encumbered purchases at $24,576. Our overall approved budget by the county commissioners is $16,503,000, and we have a surplus year-to-date of $220,757 at the end of January. I'm going to bounce over to our grant report, which is about similar to last month. We did have a little bit of traction on the COVID Regional Workforce Program. We did have some expenditures out of that. Overall, our grants are $1.9 million, and physically, we are okay. I just wanted to also mention that the Medicaid payments from the state for our per member per month were delayed in December and also in January, which resulted in some of the negative pro rata versus actual. I'm trying to think what else. Time and item state program reimbursements, and our budget for next year, which will be presented to you next month. We've met with most of the program areas to discuss their programs, and as the AAs are coming through, we're meeting with each program just to make sure that they are able to deliver on the deliverables that are stated in the AAs. Some of those AAs we know will be changing in regards to how we've asked for funding, and some of our programs we're reshifting where we can. We do have some people across the agency that may be in one area, but their operating funds come from another AA, and it's always good with so much transition to talk it through and make sure somebody that's new in a position knows that some of their budget in Munis belongs to someone else in the agency. So I will also have an update about the Smile Safari. It's coming along nicely, and I will show you the updated pictures next month for that. Do y'all have any questions about January?
Any questions for Marcia?
Oh, one more thing. We met with Epic. We're working through some files with some of the Vidant team members for our debt set-off and bad debt. We're going to do a deep dive in some of our accounts and try to recapture some of in the queues in Epic. when you send out some of the encounters, sometimes they have a way of falling in different areas, and so we're working with Epic to build some reports with that, and also a new report for our Medicaid cost study. So I'd like to give a huge shout out to Jenny Sugg on that IT Vidant team for helping and listening to us, because what she does for ECU Health is much different than what we need at Pitt County Health Department. So she's always willing to listen to us.
So Marcia, I was at the shindig today where the governor came and helped announce the grant support from United Health Foundation for telepsychiatry.
Yes, sir.
And there were all kind of signals being sent that Medicaid expansion was about to happen.
Yes, sir.
These were a bunch of politicians that were there that were talking about it. And so what are the implications of that for the health department? If Medicaid was to expand as they're sort of maybe projecting?
Okay.
Is that a good thing or a bad thing?
I won't lose my job after I state what I really want to say. So Medicaid transformation might be the biggest mess I have ever seen in my adult life working career. What has happened is that we have taken one payer, NC Tracks, and now we have taken, not just one payer, we have NC Tracks, but we've added 4 more additional payers.
Mm-hmm.
It has taken our workload and it has multiplied that by 5.
Yeah.
If I was a private doctor in the community, I would never see a Medicaid patient alone because of what they have done to Medicaid. So when I hear the word Medicaid expansion, as someone with private health insurance, you can't get down in the details because they use the word Medicaid expansion. And when you look at it, it looks like they're adding 60,000 more people to Medicaid. And in the big theory, that sounds great. But when you don't have private doctors in the community seeing Medicaid patients, those people that really need it, and that 60,000 people, are going to the emergency room for primary care.
Mm-hmm.
And if you look at who sees Medicaid patients, it is your public health department, it is ECU, it is Greene County Health Center. And if you look at how many vacancies we have, we're doing all we can do to see the Medicaid population now. So I don't know how. Yeah, we're going to see the people no matter what we do, but I think it's more complicated.
So your worry would be it's going to be more business for the people that already can't handle all the business they have already.
Correct. Because I do think I think the clinic staff can tell you we can't even send pregnant moms to the private doctors in our area because they're not seeing any more Medicaid patients.
Yeah.
So when you add 60,000 more people for Medicaid, where are they going for care? When we don't have the staff to barely see the number that's already sanctioned for the need. So I get really irate about it, but I might just have this whole theory wrong. I know people need it, but, there's so many people, like with AmeriHealth and United and, with the state health plan going to Aetna, I'm not sure how this is going to affect
Fallout, yeah.
the fallout. But I just know that, I don't know where we're going to send these patients if ECU can't fill their vacancies and we can't fill our vacancies. And the private doctors can't handle the workload of 5 payers. I mean, not just one payer, but 5. And I think you've heard me say that our business team, they're doing great, but it takes 5 people to do the deposits a month because the money comes into one checking account as the county. We have one tax ID, and this is all health departments across. And then with Medicaid transformation, they always said that the contract was negotiable. There was no negotiating any contracts with any of the big companies. So it takes 5 people to come in with that one deposit and sort out, because according to our AAs, we have to separate. So we might get a $500 deposit. It will go into maybe 6 different program areas. But 5 people have had to touch that deposit.
Wow.
And we have $300,000 in deposits a month, maybe. So I'm pretty passionate about it.
I appreciate
so there's probably a reason why I don't go, but I really think if you're going to expand Medicaid, you need to fix it first. And right now, we're all struggling.
Fix the transformation part, yeah.
Yes, sir.
I appreciate it.
Sorry.
No, that's good insight. Really appreciate it.
Yes.
Get your blood pressure back down, though.
I know.
All right, any other questions for Marcia? Don't ask about Medicaid expansion.
Yeah, I'll just wait till next month.
Yeah. Thank you, Marcia.
You're welcome. Thank
All
y'all
right.
for listening to me.
So the next items of old business, ARPA hazard pay. Is there anybody here from the county that can comment on that? John, do you have any update?
Mike Taylor's off this week. There's been no change in the distribution of those funds at this time. There's still a little shy of $500,000 in a fund for potential employee compensation. They will not do anything with that until they reach the end of the obligation period.
And can we make sure that someone's here next time from the county, like Mike or Janice, to just address that for us?
Yes,
That'd
sir.
be great. And then new Board of Health members.
We missed the date to get them on for the first meeting in February. The new board members will be reviewed, and I would assume or presume they'll be approved at the meeting next Monday on the 20th. Dr. Kakarika had reached out to me, and I told her that, you know, it was still pending, invited her to come as a guest to the audience tonight if she chose to, but I don't see her here, so I'm assuming she couldn't make it.
Okay, great. Thank you. So we'll do that next month, right? I mean, just to go back to the fiscal report, apologies, Marcia, but the chair would entertain a motion to approve the fiscal report.
Motion to approve fiscal report.
Second.
Thank you. It's been moved and seconded. Any discussion? All those in favor say aye.
Aye.
Any opposed? Before we get to the health director's report, any other new business to come before the board? Dr. Silvernail, you're up.
All right, thanks, sir. All right. Good evening, board members. Going to jump right into this. Workforce issues is my first section tonight. We continue to struggle with workforce issues. We did add a nurse in nurse-family partnership, but we're losing 2 more nurses from other programs. There's a position summary in your packet. We were at, when I met with the manager last week, we were at about 28 vacancies, down from a high of 32 with some changes or with some adjustments. Want to just run through departures and environmental health. We're losing our front office person. We had requested a second person in last year's budget that was not granted. Sometimes when that staffer is out, Angie is gracious enough to go work the front desk in environmental health. Thank you, Angie. Personal health, we had one of our part-time temporary nurses resign. She moved out of the area. We are losing one of our public health nurse 1s in clinic and a public health nurse 3 who's our BSEP, which is the breast and cervical cancer screening program coordinator. In the administration area, we're losing one of our office assistant 4s who is moving laterally in the county to county HR from the health department. In care management, we're losing a half-time social worker and a full-time community services support technician. So those are the departures from the department as of this afternoon. In recent negotiations, we've struggled to match salaries and flexible schedules of non-governmental employees. I have met with the county manager. She is willing to approve competitive offers for potential employees. I tested that after that meeting and sent a request directly to her for a salary match for a potential employee, and that salary match was granted. I do believe Janice to be a woman of her word, and that she will stick with that. If this creates an internal inequity problem, the county manager does have some existing authority to address that and give raises within the bracket to retain existing employees. The impact of the nursing shortage, staff and my nursing supervisors are here in the audience tonight, are working on a rescheduling and restructure of clinic services. That will result in about 60% reduction in clinical capacity for communicable disease health, and will result in about a 40% reduction in clinic capacity for reproductive and sexual health services.
So John, and our main liaison with the county manager, is that Mike Taylor?
Mike is, yeah, he's the deputy
So
county manager assigned to us as a liaison.
when you come to give us this deep dive on this sort of what appears to be a crisis situation in terms of staffing and how it affects operations, would you make sure he's part of that so we can hear what help we're getting from the county and its administrative heft that they should be bringing to help us out?
Yeah. I will tell you, Dr. Garrison, we're not the only county department struggling with staffing issues. Had a meeting with our county finance director today. He's struggling in his office. Sheriff's Department is struggling. DSS is struggling. Pitt department, pretty much every county department is struggling right now. I do believe the manager understands that and is willing to work to rectify that.
But I think hearing that from her would be really good. And what the systematic solutions are would be good.
Mhm.
Thanks.
We lost 2 nurses, is that right?
That's correct.
Is it salary?
One is moving to Tennessee, and one is moving on to another opportunity.
So we've been talking about this for a long time, so,
Mhm.
yeah, it's time. We need to put the pressure on to,
Mhm.
because we don't have, I can give you what's in my wallet, but it's not gonna help much. But we gotta put some pressure on and get this fixed.
Yeah.
So what the plan is, what we can do, if we need to go sit in the county commissioners and just respectfully, obviously not being ugly or anything, talk, be more than happy to do what we need to do. I will anyway. I won't speak for anybody else, but tell us what we gotta do. Don't hold back what we gotta do to get this competitive, because
Yeah,
if not, you're gonna go down more.
I think the salary issue, I think Janice has made it clear to me, tell me what offer you want, and
You got
she
internal
will-
staff too you've got to worry about.
Yeah, and that's the other side of it, because
Yeah, that's what I'm worried about.
salaries outside of the health department are often much greater than what our staff are making, or folks with lesser experience in the private sector are making more than staff with more experience in public health. So as I said, if hiring somebody at a higher number creates internal inequity, the manager does have authority to do a raise to correct that internal inequity, and is willing to do so.
Maybe we can push her to fix the inequity before you hire, so you don't continue to lose.
We talked about that. The trouble right now, salaries are so fluid. She was reluctant to just give everybody a raise at the moment and then have to come back and recorrect. She said, I'd rather get people in and correct where we need to correct to adjust that internal equity. And that
We
was.
should have some fun
that's-
conversation next month. Okay.
And then, John, also as part, so you have a slide here that says anticipated impact, 60% reduction in clinic capacity,
Yeah.
access to communicable disease healthcare.
Mhm.
And so if you, as part of that report, you could sort of project what does that mean exactly for the public health? So if we're delivering less services, what then public health problem is that going to create, or what's the worry? What's going to, how is the public's health in Pitt County going to be worse because of that? Would be very helpful, I think. And then I think everyone understands salary compression, and that if you raise the salaries for the incumbent people, you've now created an inequity for your current staff. And so you sort of have to approach it at the same time. You can't say, all right, we're going to hire these people at a higher salary, and then I think this is Lowell's point, everybody's now upset. And so now it takes us another 6 months to get the other salaries up. It's got to be a systematic sort of approach, and that's what I'd like to hear from the county managers. Are we just going to, we are now in a boiled frog situation where the frog's dead, and how now what do we do? I just think we've got to figure out what our response is, or to say it's a crisis and there's nothing we can do, but let's state that if that's the case.
Understood.
Thanks.
Want to move on and review some outbreaks of concern with you. Of course, our old friend COVID. We're approaching our third anniversary. The first case of COVID was identified in Pitt County on March 19th, 2020. So COVID will have been with us for 3 years as of March 19th. Our numbers actually look pretty good. We had a little blip, a little rise after the holidays in December. That fell off. The last 3 weeks, we really have been sort of plateaued to slightly declining the past 3 weeks. This is the curve by race and ethnicity. Same curve by age. This continues to be a disease of young adults, mostly in that 25 to 49-year-old age group. This is testing in Pitt County. This, again, our in the county testing percentage continues to rise a little bit. The regional testing percent positive continues to fall. This may be a factor of pretest probability. Sorry, I can't talk tonight. And that people are more likely to get tested when they're positive now than they were before. If you look back earlier in the pandemic, we did much more indiscriminate testing. And so I think now the pretest probability of somebody having COVID is higher, and that folks are only testing if they think they have COVID. So that may explain why our in-county percent positive has ticked up a bit.
What's interesting about that is, so that means that the surveillance bias has gone away, that there's no longer a surveillance bias where you're looking for it, so you either find more or you're testing so many people that the prior probability is not up there. So
Yeah.
in contrast to looking for unidentified flying objects, where the surveillance bias is finding more of those now. So it's fascinating how the surveillance bias works.
It is. System-wide hospitalizations continue to fall down to 79 as of midnight, 12 a.m. Tuesday. 10 people in the ICU, 4 of those on vents, and that generally runs about half of those in the ICU are on vents. Vaccinations in the county, we're at 58% of the residents of Pitt County have had at least one. 55% of Pitt County residents have completed their vaccine series. 52% of county residents have had at least one of the original boosters or extra doses, and 17% of Pitt County residents have had one of the bivalent boosters. So not as much uptake with the bivalent boosters, but we did well with the first round of boosters and extra doses. Overall vaccine uptake remains low. We're still giving COVID vaccine at the health department, but uptake is low. Other seasonal respiratory viruses. One of the many things that drive me nuts up until maybe a couple of weeks ago was the news talking about the triple pandemic here with flu, RSV, and COVID. We peaked for influenza and RSV back in November, the week of November 12th, and have fallen really steadily since then. When you look at the composite curve, we did see some growth in the number of samples that tested positive through ECU Health laboratories in adenovirus and rhinovirus, but the other numbers remain low for flu and RSV. So the triple-demic really peaked back in November, but the news media kept talking about it up until about 2 weeks ago. Here's the individual influenza chart again, showing that peak week of November 12th with cases, or not cases, well, cases, positive lab results falling steadily since then. Here's the ECU Health RSV laboratory testing. Again, peak in the week of November 5th. RSV peaked a week sooner, but again, has been falling pretty steadily since that week. Move on, talk about Mpox, formerly known as monkeypox. That's a photomicrograph of the virus itself there. Here's the state monkeypox epidemic curve. You can see we had a lot of cases through the summer with vaccination and other control methods and messaging about the disease. I think we've seen steady fall off. We do think that many cases go unrecognized. The distribution of lesions is atypical, and often there's a scarce amount of lesions on an individual. So Very possible that this infection goes unrecognized in individuals, but cases are clearly down from what we're catching in the surveillance. This is the state map, kind of showing you where cases are. As you look across this, the darker counties, of course, Wake and Mecklenburg are the two darkest counties there. We're in the 3 to 19 case range with still at 5 reported cases or identified cases here in the county. So we've been stable at that number for several months now. Our activities at the health department, we continue to serve as the Mpox vaccine hub for most of eastern North Carolina. As of 2/9, we had given 318 doses of the Mpox vaccine and had transferred 194 vials or 970 0.1 milliliter doses of Mpox vaccine. And we continue to provide Mpox testing as needed. Touch base with you on the ARPA Regional Workforce Grant. This was a Region 10 project. The Health Department, namely myself, is the regional lead for this project. We have had to subcontract out all of these projects for anything that whether it's a regional level project or a county level project, it's all had to be subcontracted with that. Individuals created a lot of extra work for us. I provided you with a summary of requested/funded projects in your packet just to show you what we were doing at a regional level. We've put 25% of the money into a pot for regional or intra-regional projects, and then each county has been given the option to spend up to 75% of their share of the funds on in-county projects. These funds are supposed to expire the end of May. We feel it's likely that they'll be extended through mid-2024, again, the end of May, likely in 2024. I wish this had been put on the same time frame as the county ARPA dollars. It would have been easier to use this money and to probably could have accomplished more with it had it been given to us on a better timeline. Some divisional highlights in our minority diabetes prevention program. Lakeela Lewis is the regional coordinator for that. She co-authored an abstract entitled Aiming to Reduce Diabetes Disparity Among Minorities by Achieving Health Equity. And the Region 10 North Carolina Minority Diabetes Prevention Program. This abstract's been accepted for presentation, and she and her partner will be presenting these at the Society for Public Health Educators Conference and the New York State Public Health Conference in beautiful New York State. I cannot talk tonight. Our communicable disease education specialist, Deborah Savage, has obtained a supply of free condoms from the North Carolina SD Condom Connection application. These will support our condom distribution program. I want to say it was 10,000 condoms she got from them. That's a fairly large number. WIC and nutrition. WIC waivers are effective May 1st. All non-contact, contract, and contract formula product waivers will expire. So they're removing those formula waivers. So you have to go back to the formula that's specified by WIC. Effective August 9th, 2023, all WIC physical absence waivers will expire. We're encouraging our clients to come in for in-person visits now in order to prepare for that. They can still do it virtually. I think they're going to have trouble putting the genie back in the bottle on this one. We've been doing no contact visits, virtual visits for almost 3 years in these programs. I think it's going to be hard to get these folks to come back in to get their benefits, and I suspect that will affect our case counts to some degree. Our WIC staff attended the Give Kids a Smile event that was on Friday the 3rd. That was Zoe Pullman, one of our nutritionists, attended that. The Her magazine nutrition article, we frequently, Robin's written several of these. Robin did another one for the February edition of Her magazine. Robin's our nutrition division director. And then just a forewarning or a highlight coming, National Nutrition Month is in March, and the WIC folks are gearing up to have some activities for that, and we'll likely have a report from them next month as well. Personal health, Thomas Debner is a DIS-2. He completed the disease intervention specialist training in November. Dr. Hardy, Director of Nursing, participated as a panelist at the North Carolina Institute of Medicine annual conference in November of 2022 that has not previously been reported to you. In our immunization program, from October 1st through December 31st, 278 vaccines were given in community sites and COVID-19 vaccine clinics. We've developed a partnership with ECU Health, Access East, and have continued that has continued monthly at the Joy Soup Kitchen. We've done community free flu and COVID vaccine clinics there. We did 2 clinics in the month of January, one at the Soup Kitchen and one at Cornerstone Baptist Church. Clinic A is our in-house vaccine clinic. Immunization services are available on Tuesdays, Wednesdays, and Fridays. In October, some of those have been cut back due to staffing issues. We are trying to use temporary part-time staff to cover that clinic. And we have a couple of folks that are very consistent in signing up, and we have some other folks who are not so consistent in signing up to staff that clinic. One final thought. Shared this with our staff at our general staff meeting this month. It's a quote from Richard Feynman, theoretical physicist and Nobel laureate. I think it's very timely given some of what's going on in recent past. I would rather have questions that can't be answered than answers that can't be questioned. And I thank you for your attention. Happy to take your questions.
Any questions for Dr. Silvernail? Thank you, John. So I think a way to frame this report next month is what are the critical functions of the Pitt County Health Department? And are those functions being accomplished? And how would we know what's measured to tell us whether they're being accomplished and not accomplished? And if they're not accomplished, what's the action plan to get them accomplished? I think that would be a good way to sort of frame what's going on.
Okay.
Any questions for Dr. Silvernail? Anything else for the good of the order? If not, I'll entertain a motion to adjourn.
So moved.
Second.
And any discussion? Hearing no objection, we stand adjourned. Thank you all very much. Happy Valentine's. And it's not too late, although my wife told me the fresh market was almost out of flowers. So.